Hello, my name is Dr. Akiba Green. We are here to talk about a non-drug treatment approach to peripheral neuropathy. What I'm going to do is I'm going to be using functional medicine and functional neurology. And really, we're going to talk about myself for just a minute. We're going to talk really about these conditions, with neuropathy specifically being our primary interest today, but really it's a bigger issue than just the little pain itself. Again, we've got a wide range of causes of those pains here today. Diabetic, heart surgery, we're not quite sure exactly where the original cause came from, maybe an autoimmune disease. The key thing is there's some commonalities that are involved with each of them. So I want to give you guys a little background on myself. When you all came into this office today, you noticed that there's a big sign overhead that said Integrative Health and another big sign that said chiropractor. I love talking about why I am a chiropractic physician doing a workshop on peripheral neuropathy. And we do workshops. Our workshop last Thursday was on integrative cancer treatment. We've done workshops, we did one a couple weeks ago on thyroid management. We do workshops all the time on autoimmune treatments and improvement. And really, when we talk about chiropractic as a profession, you get pigeonholed into a musculoskeletal model, but realistically, we're dealing with a whole health approach to improving your pain or your poor health problems without drugs, without surgery. So the key thing is, chiropractors aren't just back doctors or neck doctors. They're natural health specialists. More specifically, I am involved in several fields of study. I am board certified in integrative medicine. I am board eligible as a doctoral level clinical nutritionist. I am involved in the University of South Florida Med School's Integrative Cancer Treatment Fellowship Program. It's an AMA-backed program. It's the only fellowship in the country that helps take the best of a oncology and traditional approach to an alternative and integrative approach towards helping cancer patients. I am also involved in the Carrick Institute of Postgraduate Training, working towards a degree in chiropractic neurology. It's a lot of training. It's a lot of studying. This year alone, I went through over 300 hours of continuing education. And this is a key piece of why you're here and what you're going to get with me. It's a doctor who trains, who reads research, and who knows what's working today, not something I learned in school 20 or 30 years ago. When we practice functional medicine, when I practice functional or chiropractic neurology, the goal is to get your health to balance itself out and normalize, not just give you a symptom pain reliever. You don't just want to cover it up. I've got a couple goals for you guys today. Number one, the biggest goal for all of you, I am here to reinvent your life. You're here to find another path. I'm here to give you an option to get relief. What can I do to give you an exit strategy? How do you get off that train of pain and step into a new path to help get the answers that you're looking for? And I really genuinely try to, with every human being I come in contact with, I try to leave a positive impact. And the goal is what can I do to make your lives better over the next 45 minutes? So as we talk about peripheral neuropathy, how many of you are sick and tired of going to the doctor only to be told that there's really nothing that they can do for you? And sure, they're not getting results. And again, we're suffering a year, 3 months. You've had diabetes,
I've had diabetes for over 12 years.
So, we've had problems for decades, and you're not better. And if we talk about diabetes for one quick second, they have not cured your diabetes. They are not trying to cure your diabetes. They are trying to, what they call, manage your diabetes, which means they are satisfied with you being a condition that goes from really bad to just bad. And if you keep in mind, we'll talk about A1Cs, we'll talk about some of these tests a little later, but if you keep in mind, what I know is the doctors that you guys are seeing don't know what they're doing. When I see neuropathy patients, a lot of these patients that come in to these workshops have had peripheral neuropathy for 5, 10, 15, 20 years. They've been on Neurontin, they've been on Lyrica, they've been on Cymbalta, amitriptyline, morphine, cocktail drugs that would kill me if I took one dose, and they take 8 doses a day. And they feel no better at all. When you talk about how long you've had your problems, that's part of the reason why we know they're not helping you. We know they're not getting you better because you've been living with these problems for months to years. And if we talk about why your doctors aren't getting you better, they don't know this, An overwhelming majority of physicians don't read medical journals. I talked about the research that I've gone through, the training I've gone through this past year alone, and we're talking thousands of hours of continuing education in the last 10 years of my practice. There's simply no time in a modern insurance-mandated world for the doctors that you're seeing, the neurologists, the internal medicine doctors, the pain management doctors, to get training anywhere other than their one annual meeting they go to for their association, or what the pharmacy reps bring them about a new drug they can treat. They rely on what they learned in school, and many times that's 15, 20, 30 or more years old, and it's simply outdated information. You know, the textbooks that I have, again, those textbooks, we go back 10, 12, 14, 15 years when I was in chiropractic college. Those textbooks were published another decade before that. And the content in those textbooks, in many cases, was 20 or 30 years old at that point. So literally, what I learned in school a decade and a half ago was 40 years old. It's obsolete. And then you take a neurologist that you've seen who maybe has another 10 or 15 years on me, and you talk about how much older that information is. Quite literally, they don't know what they're doing because they're not staying on top of how to treat. Over the past 6 years, I have been treating peripheral neuropathy patients incredibly successful. Over the past 4 years, I've been practicing functional medicine, and we've been helping the many causes that contribute to the neuropathy besides just the pain management aspect and giving them relief with therapies. We've been getting to the root causes of why you have this dysfunction. Again, your diabetes, an inflammatory issue from your surgery. Again, we talk about autoimmune issues that we see. One thing I know, and I want you guys to write this down, okay? You guys, we're going to use our papers a little bit. You're all suffering from something called a web of physiological dysfunction. Now, what this is, I'm going to write it down on my whiteboard. When I say a web of physiological dysfunction, you got it right here if you need to see it. None of you in here, of the 4 of you, none of you have just one problem. Physiologically, it's an impossibility. What I mean by a web of physiological dysfunction is you're all suffering with a myriad of different problems that are contributing to the symptoms that you're experiencing today and calling neuropathy. If we talk about that web, again, blood sugar is a huge, huge indicator. We talk about diabetes, insulin resistance, inflammation. We talk about adrenal involvement, gut problems, the thyroid. You can talk about liver dysfunction, immune problems, neurological problems. We'll talk about where your pain comes from in a couple minutes. Cellular dysfunction, damage to those tissues. And again, your web of dysfunction, you all have brain problems. Every single one of you has a problem with your brain. You all have nerve problems. Neuropathy is damage to nerves. Peripheral neuropathy is damage to the peripheral nerves. Literally, it's a problem where you have loss of function in your peripheral nerves. It doesn't tell you where it comes from. It just tells you that's what you're dealing with. You all have most likely thyroid problems. You all have most likely gut problems, and I'll talk about why in a couple minutes. We talk about short-term memory. We talk about metabolic problems, again, leading to your heart surgery, whether it was a heart attack or stents and damage that was there. We talk about inflammation and cardiovascular disease, diabetes and blood sugar problems. We talk about thyroid. We talk about all these things that contribute to the autoimmune issues that some of you are dealing with. And quite frankly, they don't make a pill for this kind of problem. They can't give you a pill to help your web of dysfunction correct itself. So we're going to talk about your web. Before I get into that, we're going to write our own webs down on our paper, and I'm going to walk you through, and some of the paperwork that you filled out, I'm going to walk you through where your symptoms are coming from, and we're going to paint a picture of how we can get you better. But remember, I told you all that you had a brain problem. You may have looked at me and said, "What are you talking about? My brain feels pretty good." I want you to go to page. I want you to go to page 4 for me. Okay, it's the yes no. You're already there, Joseph. I want you to go to that yes no page right there, and we're going to talk about 4 main areas of the brain. We're going to start when we talk about your brain. Hold on, come get you over here. We're going to talk about first and foremost the frontal lobe. Now, the frontal lobe is where all of our personality is located. Now, if you've noticed some changes in depression, anxiety, irritability, changes in how you feel as a person over the past few years, the frontal lobe is where these problems are occurring. If you talk about the hippocampus, this is another big area in the brain we got to talk about. It's right below the frontal lobe, and the hippocampus is where all of us store our memory. If you have a brain problem, if you have a memory problem, you have a problem here. And the hippocampus is incredibly important. As we talk about some of the causes of your neuropathy, it can impact that memory significantly. This next one is really, really important. It's called the parietal lobe. And we're going to talk about neuropathy for just a second. And obviously we talk about symptoms. If we talk about symptoms, the first thing that happens with somebody who has peripheral neuropathy is you get what are called the negative symptoms of neuropathy. You lose something. You lose sensation. You lose the ability to feel temperature. My father-in-law is a diabetic. He has neuropathy, and he lives in Sarasota, Florida, and he crosses the street to go to the beach, and he can walk barefoot on 120-degree concrete and literally not feel a thing. That is neuropathy. Okay, and it doesn't have to be that severe. That is a severe case. If he closes his eyes, his balance falls because his feet don't know where he is. He cannot feel them. What we have to keep in mind is that's the negative symptoms of neuropathy. What happens is over time, you don't just lose something, your brain changes, and you actually get what are called the positive symptoms of neuropathy, which are not actually good. Positive means that your brain has to start replacing those missing signals with something else. We talk about burning, shooting pain, pins and needles, achiness, toothache in the leg. These symptoms that we see are what we call positive symptoms of neuropathy. And for those of you that maybe experience burning, if you look at your feet, they're not on fire. The reason you feel burning is because a part of your brain, the parietal lobe, is misfiring. That's where all of our sensory input in the brain goes, every single bit. So paint this picture. Your nerves are damaged. I'm going to show this for you, okay? What you've got is you've got this peripheral nerve. Let's call this your foot, okay? You've got this nerve that comes up, it goes into your spine. From there, it's going to shoot up to your brain. In a normal functioning person, you're going to get that signal intact, it's going to go to the brain's going to say, oh, I know what to do, I know what that is. It's going to send a signal back out to the spine, and then you're going to get an action back in your leg, whether it's sensation or movement or something. When you have neuropathy, you have a problem here. Those nerves are not working right. Those nerves that are short-circuiting go up the spine. They go to the brain, and the brain doesn't know what to do with them because it's not the signal it's expecting. So it's going to turn around and send another signal back out. That signal is the pain that you feel. So where is the pain coming from? You have damage in your feet, but the pain's not coming from your feet.
Yeah, and like sometimes when I shower and I look down at my feet, it looks red.
Sure.
And then I say, but why, if I'm running hot water on it and everything, it shouldn't be like that, but it, like the color changes, you have that deep pink red look.
Sure. So what's happening?
Not always, but when it's really burning.
Absolutely. What's happening is your brain is replacing that signal with a signal it thinks should be there. And that signal is always going to be pain. What we're talking about, if it short circuits, you're going to get that pain, that numbness, that tingling, that burning throughout your body. So when we talk about the parietal lobe, it's a very important area that we're looking at with you. Now, again, there aren't enough pills in the world to fix your parietal lobe. If we talk about the standard of care for peripheral neuropathy, and I mentioned a couple drugs before, Cymbalta, Neurontin, gabapentin, amitriptyline, Lyrica, all these medications are what are commonly used. And what you're going to see is they don't work. Gabapentin is designed to help calm your body down. It's actually, it's not even designed to help with pain. That's not what it does. But what it shuts down that pain, and then what happens is the body then says, hey, I don't like this, and it overrides it, so you need higher and higher doses. And at a certain point, the dose of medication you have to take is so high and the pain never goes away, that the side effects far outweigh the possibilities of actually using those tools to give relief. If somebody has short-term memory loss, there are no pills that are going to fix that. If you've got this pain, the pills don't work. So when we talk about your brain, it controls every function in your body. It's not just what you feel, but it's everything going on. If you look at that form, the page that I told you guys to look at, the one that had all those yeses and nos, it's called a neurological assessment form. If you look at this form, if you mark more than 5 yeses on here, we know your brain is not functioning the way it should. For more than 5 yeses, you have a brain problem. What the brain does is it sends that electrical signal down your spinal cord, and it goes everywhere. It goes to your feet, goes to your hands, goes to your thyroid, goes to your stomach, goes to your pancreas. It goes everywhere. If you don't believe me, the other paperwork I have you fill out there, the metabolic assessment form, is going to help show us what organs are malfunctioning in your body. And we're going to walk through what's not working and how we're going to correct it. So what we're going to do is we're going to draw out our own web of dysfunction. And I'm going to do my own right here. And we're going to start. I want you to go to page 2 for me. It's the one that has category 1 at the top of it. You're going to turn that page over. It's the other side. Olivia? It's the other side.
This says category 1.
That's category 9. Flip it over for me.
Oh, sorry.
That's okay. That's okay. Yeah, and you're on it. That page right there. Absolutely. Yeah. So I didn't have you guys all fill this out, and that's okay. You can fill it out on your own. But we're going to walk through each of these sections. If you got them filled out, in category 1, how many of your doctors that you went to for your neuropathy condition looked to see if it was being caused by problems in your colon? Probably no one. If you have any 1s, 2s, or 3s in category 1, you have a problem with your colon. Categories 2 and 3 are your stomach. We talk about stomach acid is very important for proper nerve function. There's an infection called H. pylori. This infection is often associated with neurological symptoms in the brain. You see it fairly significantly, and it's something that we have to look for. If you have any 1s, 2s, or 3s in categories 2 and 3, you have a problem with your stomach. Category 4, and what we are is we're right here. Okay? If you have any 1s, 2s, or 3s in category 4, you have a problem with your small intestine. And this is important because 90% of your food is broken down or assimilated in the small intestine. If it's malfunctioning, there's no way you can process that food and turn it into energy for your body to heal right. Category 5 is your gallbladder and intestine. Excuse me, gallbladder and liver, I apologize. How many of you have had your gallbladder removed?
Had what?
Gallbladder removed. Good. Don't let them. Your gallbladder not only regulates bile, but it also makes your liver work a lot easier. And it's crazy because I see patients who have had their gallbladder removed, and in category 5, they've got 3 circled and all these symptoms. So they still have symptoms of liver and gallbladder dysfunction, even though they had it taken out. That doesn't make a lot of sense, does it? You know, the liver is very important for metabolic function. Thyroid conversion occurs here. B12 methylation occurs here. Hormone clearance occurs here. Detoxification, removal of toxins occurs in your liver. If you have a problem with your liver, it's going to impair your body's ability to function right, and you're going to see symptoms associate with your chief complaints. Again, diabetes, neuropathy, heart disease, thyroid dysfunction. The liver is important for all of those. And like I said, they can take it out. We can remove your gallbladder, we can remove your liver, and you still have those symptoms. It's crazy. So it's the genius of medicine. You can go get a surgery, have it taken out, and you're still going to have symptoms of it. You know, talk about back surgery. I've got a colleague of mine. He's works with one of the big spinal groups. He's a orthopedic spine surgeon. And when I first met him about 10 years ago, he was really excited about the success rate that they had with one of their non-invasive spine surgeries. For back surgery, he had a success rate of 38%. And he was excited about this. He said, 38%? So you're telling me 62% of the time you're going to fail the surgery that you're doing, and that makes you feel good? That's a problem. And if we really talk about what you're getting into when you talk about these traditional systems, I really genuinely believe the only good thing about insurance is it keeps incompetent doctors in business. Most of you are not going to your doctors because they're good. You're going to them because they're on your insurance plan. Your insurance covers them. They're not good. You're still suffering. You're here trying to find a better path. And that's important because if we're going to get you better, you have to realize that sometimes you have to go to the doctor that's going to get you better, not necessarily the doctor that's going to be the easiest one on your plan to get you in. And really, it's only one thing that matters. I mean, it's really quite simple. I'm going to write it on the very top, and I would recommend you do the same. All that matters is results. You're not getting any. You're looking for answers, and you're suffering. I don't care if it's 3 months or 12 years. You need results, and that's all that matters. So if we talk about where your symptoms are coming from, we've looked at 5 sections: the colon, stomach, small intestine, and liver, gallbladder. All 5 of those sections, I'm going to circle, and we're going to call them one thing. We're going to call that your gut, your gastrointestinal tract.
Your colon. What was number 2 you said?
Your stomach. 2 and 3 is your stomach. 4 is your small intestine, and 5 is your liver, gallbladder. Those are all your gut, your gastrointestinal tract. I told you earlier you guys have immune problems. I told you you had gut problems. 80% of your immune system is located in your gut. It's called enteric immunity. What that means is when your immune system's not working right, and none of your immune systems are working right, you have a problem in your gut. Any 1s, 2s, or 3s can tell us which part of it, but there are people who don't even have symptoms of GI dysfunction, but they have an immune problem, so you still have a problem with your gut. And even Hippocrates, going back to the father of medicine, said, look to the gut, you'll find the origin of almost all human illness. This is something we have to look at. And what we're talking about here is anything that causes an immune battle in your gut will trigger inflammation. So if you have an infection, I talked about H. pylori, it's a big thing I see with neuropathy patients. If you have a bacterial infection, it's going to contribute to inflammation. If you have a parasite or fungus or yeast, it's going to contribute to inflammation. If you have a food sensitivity, if you have a problem eating certain foods, and sometimes we talk about the traditionals, hey, you know what, I eat oily or greasy foods, I feel upset. But more importantly, there's a growing body of research that links peripheral neuropathy to food sensitivities, including gluten sensitivity. I've got several papers that directly correlate neuropathy with celiac disease. It's a huge thing that we see. We have to look and see, because quite simply, you could have a problem where you never had problems eating food until something triggered it. And that trigger turned a gene on, the pain came, and your body started attacking through your immune response, your feet, or your heart, or your thyroid. And the key thing is, once it's turned on, you can't turn it off. So I've had patients that I've seen who were in their 80s, who we found a gluten sensitivity problem for the first time. They had it their whole life. You know what? They stopped eating gluten, we fixed their problems, and their symptoms got better. More importantly, if we find one food, and I look for 27 different foods, everything from soy to egg to dairy to wheat to coffee. If I find one food that your body attacks when you eat it, and that means I see antibodies, so there's an immune response, then every time you eat that food, your body is attacking your immune system, and it's making you sicker. So if we find it, we have to get rid of it. If we move right along, the gut is a huge, huge piece of what we look for. But another big one, for 2 of you absolutely, but really for all 4 of you, is blood sugar. And in category 6 and 7, if you have any 1s, 2s, or 3s in category 6 or 7, then you have a problem with blood sugar. Now, an interesting stat with neuropathy, we associate diabetic neuropathy with peripheral neuropathy. 27 million Americans have peripheral neuropathy. 40 million Americans have diabetes. I've heard that stat is even higher in some cases. I've heard, but here's the thing. If you have peripheral neuropathy, you may not have diabetes, but if you have diabetes, the American Diabetic Association says you have to be screened for neuropathy. You can have insulin resistant. You can have an A1C of 5.6 or 5.7 and a blood sugar of 103 and be non-diabetic and have the same risk of developing neuropathy as somebody who has an A1C of 9 and blood sugar of 180. The risk is there, Once your blood sugar starts malfunctioning, it doesn't matter how severe it is, the neuropathy can come on. Now, optional functioning blood sugar for every single one of you, 85 to 99 is where you should be. If you're not there, if it's too low, it's going to kill those nerves in your feet, in your hands, in your brain. We're going to get you better for maximum results. If I'm going to get your life back, we're going to fix you, I got to fix your blood sugar. This is a huge, huge thing. And if we really talk about blood sugar, it is not acceptable for a doctor to take a patient who has an A1C of an 8, put them on treatment, and get that A1C to a 7 and say you're good. Because you are still severely diabetic, and that A1C may be improved, but it's nowhere corrected. It's nowhere at a point where your life is not shortened. You don't have risks of diseases from neuropathy to amputation to heart attacks. So when we talk about doctors that manage patients and say, you know what, I'm happy with your progress. And I see this with notes all the time. They come back and it shows, you know, patient's A1C is 7.2. It's improved from where it used to be. It's stable. I'm going to keep them there. They're giving up on you. They're lazy. They're not fixing you. We need to get that A1C well below 6, really below 5.7. 5.5 makes me really happy. If we don't get you there, then we're not doing our job. And your blood sugar, 100 is not acceptable. Fasting blood sugar, 85 to 99. And even 99 I'm not really happy with, because if you think about it, if at 100 you're insulin resistant, well, 99 is pretty close. So really, I look at 85 to 95 as my happy zone for patients. If I can get your fasting blood sugar into that 85 to 90, 95 range, then we've done our job. And it can be done. That's the crazy thing, is metformin as a drug, which is used so often, there was a study that showed that metformin improves insulin resistance 40%. The same study looked at vitamin D supplementation and found that vitamin D alone improved insulin resistance by 60%. So what do you want to do? Do you want to take a drug, or do you want to take more vitamin D? Your body needs oxygen and it needs sugar if it's going to function right. This is the fuel that our nerves need to communicate. Poor blood sugar is going to lead to poor brain function. One of the big things that contributes to that are these next two categories, categories 8 and 9. Does anybody here have problems with sleep? Sure. Problem sleeping? Trouble sleeping? So if we talk about it, cortisol is a hormone that's made in your adrenal gland. The adrenal glands sit on top of your kidneys, and they release cortisol and other hormones in response to stress. If cortisol goes up, you know what happens? It'll actually impact your brain. There's a direct link between cortisol regulation and that hippocampus. So if you're under stress, you're actually going to see short-term memory problems get worse. It's important to understand that cortisol also sets your sleep cycle. It should be high in the morning, low at night. And what I see with a lot of people who have trouble sleeping is either their adrenals are worn out and cortisol is just really based, or we see that it's spiking. Instead of it being down, it's high. And you're seeing that your body's saying, you know what, I don't want to sleep, I want to go out and party. We have to get your adrenal gland corrected, and there's another reason for it. When you have adrenal problems, they also release epinephrine and norepinephrine. This will stimulate pain fibers abnormally. It can lead to your symptoms. And we're all at risk of adrenal problems. There's 5 stages of adrenal function, and adrenal fatigue happens when that constant stressor impacts us over and over and over again. And that stressor could be work, or it could be a pill that you're taking. It can be a drug that you're on, or a stressful event that you had, or even the food that you're eating. And there is, again, a direct correlation between categories 8 and 9 in that neurological assessment form, because cortisol destroys the brain. It impacts that significantly. Categories 10 and 11. This is your thyroid. There's a huge correlation between thyroid disease and neuropathy. I see patients that come in all the time with thyroid problems. Their hands are numb, their fingers tingle, their toes tingle, they can't feel their feet properly. We got to get your thyroid functioning right. Category 10 is low thyroid function, category 11 is high thyroid function. If you have a bad thyroid, you're going to have a bad brain. If you have a bad brain, you're going to have problems with neuropathy. Every cell in your body has thyroid receptors. Every cell. It's that important. The thyroid gland supports bone metabolism, immune system function, nerve function, endocrine function. You talk about your hormones. It supports your gastrointestinal function, reflux issues, stomach digestion. It supports growth and sex hormones, fat burning, healthy blood sugar metabolism. If you are diabetic, you have a thyroid problem. And when they run a standard test, they don't look close enough. They really don't. They do the bare minimum test. Talk about that TSH. So if we're going to get you better, we have to get your thyroid functioning better. And we have to do a full test to look at what's going on with it, which includes antibodies and includes the proper evaluation. Because every cell in your body has thyroid receptors. Now, you may be hypothyroid and not have a diabetes problem, but if you have a blood sugar problem, thyroid is involved. Now, there's something called the HP axis. The hypothalamus is in your brain, and the pituitary gland is right outside. Pituitary gland and the hypothalamus regulate all your hormones in your body. So your thyroid hormones, TSH, your adrenal hormones, cortisol, your male and female hormones, your sex hormones, testosterone, progesterone, estrogen, LH, FSH, DHEA, all these hormones are regulated by one common area. What that means is if you have a problem with your adrenals, you are going to have a problem with your thyroid because of the feedback loop that occurs. One problem leads to another problem in the body. How many of you have had blood work done and they've told you your lab tests look normal? Sure. So I see there's a good bit. What's happening is either they're not running the right tests, and they don't. Again, with insurance, you get the bare minimum tests. When you get the bare minimum tests, what do you usually get? The bare minimum results. So they run a screening test, and they say TSH looks good today, so I'm not going to check the rest of the thyroid. Well, TSH is the pituitary gland. T4 and T3 is what the thyroid's producing. T4 has to convert into T3 in the liver and everywhere else, and then T3 has to be used. So if you just ran TSH, did you check any of those other problems? No. So they're saying everything's good, but what they're really doing is they're really blindfolding themselves and trying to go skeet shoot, clay pigeons out in the middle of the dark. It's good luck. You're not going to get very far. They're playing Russian roulette with your health. And, that's our system. Again, unless you're so sick that there's something wrong, they're not going to find it. And the other big problem we see with these lab tests being normal is they use traditional lab ranges. So, I use the same labs your docs use. Quest, Solstice, LabCorp. These lab ranges come back and they give me a reference range. That reference range is based on statistics. It's a bell curve. It's based on who gets blood work done. If you talk about who goes and gets blood work done every month, what kind of a person would that be? A sick person. You're not getting blood work done every month if you're well. You're going there because you have a problem. So that blood work gets put into a statistical pool. And then all those statistics come back with a range. It's based on an unhealthy population. There are lab values that have been published in the medical literature. They're called functional lab values. They're more sensitive and they help us reveal problems before we can name a disease after you. We never want to be that far gone. And what we're talking about is if your lab tests are normal, but you don't feel good, well, they're probably not here where it says lab low or lab high. They're probably in this little in-between range where you're not ideal, but you're borderline, but they're not going to do anything about it. I mean, the liver is the biggest one that kills me on this because, and we'll talk about one other test up here, but the liver, liver problems, okay, liver problems. And all of you, we talk about the symptoms you're dealing with. Liver is a huge thing we have to look at. Your doctors are going to say, you have a liver problem. Stop drinking. And you're going to say, I haven't touched anything in 30 years. They're going to say, okay, well, we'll check in 6 months. And literally, that's what they're going to do. They're going to say, you have a liver problem. We're going to keep an eye on it, and we're going to see what it does. Well, I'll ask my patients, how are they treating your liver problem? The patients go, well, they tested it. I said, no, I didn't ask how they found it. I said, how are they treating it? They said, well, they tested it. I said, they're not treating it. They're looking and saying, you have a problem, and then they're going to monitor it. At what point did medicine say we are not here to help get people better? We're here just to monitor and see how bad they get and be able to tell them when it's really bad. Now, there's a disconnect. If we talk about sugar, 85 to 99, we've talked about that range, 85 to 95 being ideal. Again, there's a medical range that's a little broader than that, especially on the low end. Talk about 99 is the high end. They've pretty much that's the traditional high range. But I've seen people come back with a 70, and the docs say you're great, and the patient's like, I'm lightheaded, I can't drive. I mean, I'm falling apart because they're hypoglycemic. But yet the lab shows they're in the normal range. Anybody I know who has a blood sugar 70 is not normal, and they'll tell you that they feel horrible as a result. Cholesterol is another one. The World Health Organization just published new levels. These levels say the ideal, best cholesterol level to avoid death is 236. Yet you go to your doctor and they want you under 200. If you want to get better and you look worldwide at statistics, epidemiological data, the World Health Organization has said the people that live the best have cholesterol levels 220 to 236. That's the range they're looking for. Hemoglobin A1C is the other one. And then we talked about, blood sugar, diabetes. 5.5 is ideal. If you're above 6, if you're above 6.5, if you're above 7, if you're above 7.5, if you're above 8, you're getting worse and worse and worse. And like I said, if it gets a little better, well, congratulations, This is, you're going to die tomorrow. This is, you're going to die a year from now. This is, you're going to die 5 years from now. Why don't you want to be way over here? You want to be healthy.
Without pain.
Yeah. The point is, if you want to be normal, go to Walmart. Go to Cracker Barrel. Go to somewhere where a lot of people go. Something in the popular literature, the popular, you travel, and get a lawn chair and sit out in front and look at who goes in and out. That's normal. I don't want any of you to be normal. I don't want to be normal. I want to be healthy. If you want to be healthy, you can't rely on these huge, giant normalities that mainstream medicine puts us into. One last category we got to talk about is categories 14 through 17. These are hormones. 14 and 15 is our male hormones. We're talking libido issues, andropause, prostate disease. 16 and 17 is female problems. If we're cycling, it's a fertility issue, menstrual cycle problems, menopausal symptoms. I see patients all the time who have been postmenopausal for 15 years and they have hot flashes still. Well, there's something wrong. Your body's not functioning the way it's supposed to, and it's got to be fixed. Why? Well, hormone problems come from blood sugar, number one. That's the biggest thing that leads to a hormone issue is insulin resistance. They are now saying metformin is a medical treatment for fertility because they know that PCOS, polycystic ovarian syndrome, is the number one cause of infertility, and it's an insulin resistant problem. So they're treating it as basically an insulin resistant or diabetic. And adrenal issues, thyroid issues, brain involvement, all these things, talk about that HP axis, that hypothalamus pituitary axis we talked about, that feedback impacts your hormones. The point is, if I'm going to get you better, we got to figure out what your web of dysfunction is. What makes you have the symptoms you have? Why did your symptoms begin after a surgery? Why did your symptoms develop because of diabetes? Why did we have these problems that got worse and worse and worse when you think you're doing everything right? If we talk about all these problems, there's a lot we covered. There is an order to all this chaos. If I'm going to get you better, I have to fix certain key things. If I don't look at these problems, you won't get better. We call these health breakers. First and foremost, most importantly, peripheral neuropathy is considered an autoimmune disease. We have to look at that. Do you have antibodies against your nerves? Do you have antibodies against other parts of your body? Your pancreas, your thyroid, your gut, your brain, elsewhere. Blood sugar. What kind of a blood sugar problem do we have? Is it something that we can correct? The number one stressor in our body is blood sugar. Diabetes, I've seen a patient have A1C at 9, bring it down to under 6 in 45 days without medication. If you eat the right way, if you correct the processes that are in your body can get better. And that's a key thing. We have to look at anemia. And I don't mean iron. When I say anemia, I mean red blood cell dysfunction. Iron could be one of cause, B6, B12, pernicious anemia, all these causes we have to look at and see how your body's transporting nutrients. Inflammation. So all of you have an inflammatory problem. Your nerves are inflamed. We have to look at homocysteine and C-reactive protein. Are these nerves contributing to your symptoms? Are we seeing inflammation attacking your body? We can lower that inflammation. It's like somebody taking a blowtorch to your nerves, to your foot. That doesn't feel very good. Obviously, we want to fix it. Gut dysfunction. Obviously, we know 80% of your immune system is in your gut. If you have an immune problem, what's causing it? Are they food sensitivities? Are they infections? Is it a stomach acid problem? We have to balance that out. Your thyroid is a key thing we have to look at. And it's not just the gland. It's not just what your body's producing TSH-wise. Is your body using the hormone properly? Is your immune system attack against it? How about your fatty acids, lipids, triglycerides, cholesterol? What is your body doing to process? Is there too little? Do we have a healthy range, or is it out? If I'm going to help your neuropathy, what we're going to do is we're going to remove causes and antigens that are contributing to your web of dysfunction. Blood sugar, food sensitivity, infection, hormonal imbalances. So we're going to correct those. And here's the thing. We all have two halves of our immune system. It's called Th1 and Th2. When a normal person gets sick, you get a shift. Th1 may shift, Th2 may shift. Your body's going to fight the infection and then calm down. Th1 is kind of like the Pac-Men that go and kill stuff. They get rid of it. It's like our soldiers. Th2 are the markers, the antigen, they antibodies. They tell us where things are. When you get an autoimmune disease, you get a shift, or you may get a dominance of Th1 or Th2, but the body never calms down. It never corrects it. So the immune system is being pushed, and we have to fix what's driving it. That's your web of dysfunction. These things we've talked about, those health breakers. But once I remove that, it's still up here. You still have the shift. The scale's tilted. So we have to balance the immune system out. We use simple supplements for that. Vitamin D, glutathione, fish oils, curcumin. There's many tools that we use to help balance your immune system out. And if you're taking drugs, I've got patients that come in who said, I'm on antibiotics long term. Why? Don't have an infection. Well, they said I may get one. So what's happening is this patient is taking an antibiotic that's going to cause their body to develop a resistance against it, so they can eventually get an infection. That's smart. It doesn't make sense. So, you may be taking supplements. If you're taking supplements, we have to remove any stimulants that you're taking that are pushing your immune system the wrong way. Patients come in with a box of supplements, 25 things they take a day. Half of them are helping them, the other half are making them worse. So we have to see what you're taking, and is it good or bad for you. And we use therapies in my office. They call it brain-based therapy. It starts with infrared light therapy, which has been shown to help heal nerves. It turns those nerves back on. It will literally grow them back. We use something called the rebuilder. It's an electrical nerve therapy that runs at a very low frequency that will send a signal up those nerves, almost like you're testing an electrical wire. So you want to send a signal up, and then the brain's going to get that signal and send it back out, and it helps rewire or modulate the nerves that are damaged. We use decompression, spinal decompression therapy, oxygen therapy. We have to give your nerves fuel. And I do a lot of unique treatments, everything from vision. We have these glasses that people wear that have LEDs in them to stimulate your parietal lobe, to sound therapy with the metronome, to even some patients will use calorics. I've got a patient who has a chronic autoimmune neuropathy. The treatment for him for 2 years was something called an IVIG injection. Those injections cost his insurance $20,000 a month.
Wow.
If he didn't get that injection, the burning was severe, in his hands mostly, but his feet too. Literally within 7 weeks in our office, he no longer is getting those injections because we fixed what was driving it. The therapies we're using, some of the therapies we've now gotten using at home. I mean, he drives a long way to come see me. We're talking 2 hours, each way, and we're doing it once a week. And seeing the improvement we are with him is what I expect to see with every one of my neuropathy patients. Because we use an approach that addresses the why, your web of dysfunction, the how, correcting and balancing out your immune system, and then using therapies that will correct and fix the abnormalities that we see with your nerves. Those therapies, we know what to do based on testing. And testing is really the key thing. If I'm going to test you to figure out what you need, you have diabetes. Well, is it a pancreatic immune problem? Is it a food sensitivity and liver issue? Is it simply a blood sugar regulation issue? What's causing it? Is it a thyroid problem? So by finding that out, we can get you corrected fully. Does that make sense? Are we getting looking at the whole you allows us to treat you properly. If we're going to do that, it takes more than just listening to me. Life is a matter of choices. My goal is to reinvent your life. I told you that when we came here. I'm here to give you that exit strategy. I feel like I've given you a path, and I've done that. But if you're going to get better, you have to take the first step. Knowledge alone doesn't do anything. You have to use action if you want to get results. I want you to ask yourself, what can improve in your condition with your diabetes, with your knee and foot pain, with your heart issue, with your pain that you're feeling, with your thyroid. What will happen if you decide to make an appointment with me and sit down and see how we can help you one-on-one? And more importantly, I want you to think about where you see yourself in 3 years if you don't fix what we've talked about. If your problem continues to get worse and you go on the system that we've talked about that isn't necessarily interested in correcting you. They're interested in just doing the bare minimum to identify where your problems are coming from, and you end up on this merry-go-round. If you like what you heard, I can sit up here all day. It's early. You can preach if you want, but that's not what I'm about. I'm here to help you. If I'm going to help you to reinvent your life, the only thing you guys have to do is make an appointment. I do a 2-visit new patient process. Those 2 appointments are going to be a full evaluation. What we're going to do is we're going to do an examination on you, looking at why you have neuropathy. The testing that I do can tell me if your parietal lobe is functioning properly. It can tell me if your brainstem or your cerebellum is functioning properly. It can tell me if the light touch receptors or the chemoreceptors or the vibration receptors in your peripheral nerves are working right or if they're damaged. And we'll be able to determine, are we dealing with a large fiber or a small fiber neuropathy? What's causing it will come out of my examination, and we can help determine the best forms of treatment to help your specific problem. When you come in for that first exam, I would ask you to bring loose-fitting clothing or a t-shirt and shorts because we're going to be doing a peripheral nerve exam on your hands and feet. We're going to be looking at your nervous system significantly. But we're also going to do a case review. If you've had labs done, I want them. My staff can do a good job helping track them down. If you don't have them yourself, that's fine. But we're going to look and see what your doctors have done for you. What's happened before you to get you to this position? What can we do to get you answers? A lot of times what I see with these tests that have been done is not a lot has been run. They run the bare minimum. Even somebody who says they had an autoimmune panel, sure, they look for rheumatoid disease, they look for lupus, but they didn't look and see what your immune system was actually doing. They just looked for 2 autoimmune diseases that you didn't have. So it's an issue of the level of testing that gets done. The second visit is your report of findings. So we're going to go over your results. We're going to talk about what you've actually got wrong. I'm going to talk about how I can help you. What are my best recommendations? What testing do we need to do? What do we have to do to get you answers? What treatments do I think are going to improve your health, and how long is it going to take to see a result? We're also going to talk about what it's going to cost. The reality is, right at this moment, I have no idea what you're going to need or what you're going to need or what you're going to need. So we don't know what the cost is for your care because everybody's insurance is different. We see lab coverage is usually there to a certain extent. Some insurances are better than others. But when I see you, I promise you that we'll know. My staff's good at identifying that, and we'll be able to give you a very clear picture of what you're looking at. It is my experience, unfortunately. Like I said, when you talk about the traditional medical model, that you don't see coverage for everything that we do. Sometimes you have to reach into your pockets if you're going to get better. But we let you know what your options are, how we can help you, and it's my job to give you a path that you can take, and we can figure out a way for it to get accomplished. With that being said, what we do is my normal 2-visit process is normally $450 for both of those visits, and I'm going to spend about 2.5 hours with you between our visits and reviewing your case. Because you guys came and joined me this afternoon, I reduced that down to a $60 reservation fee. That same 2 visits I give you for only $60. It gives you the opportunity to come in and meet with me and see if we can help you without having to make that huge commitment up front. With that being said, I thank you very much. Andrea is waiting up front. She'll be more than happy to help schedule your appointments. I look forward to meeting with you one-on-one. Thank you.